Community Living Center is a traditional nursing home within the VA healthcare system where we have taken the concept of creating a home environment for our residents or our veterans who live with us. We create an environment where it's not as institutional as your traditional nursing home, creating small neighborhoods where possible, offering residents choice in their meals, their activities that they participate throughout the day. They do arts and crafts, we do gardening, we have opportunities for the residents to go out on field trips to neighborhood libraries. We have opportunities where school groups come in and present programs to our residents, just a variety of different things that go on throughout the day. Typically, the veteran who's a good fit for the Community Living Center is someone who needs assistance with their ADLs, or their activities of daily living, which is one of the admission criteria. So the nursing staff assists that veteran because they're no longer able to live independently in their home.
How was your lunch?
Lunch, good food.
Good
The
food.
best food.
Best food.
Eligibility criteria for Community Living Center: for our long-stay residents, you have to be 70% service-connected or greater, or 60% with non-employment eligibility. We also have a program for our short-stay residents, which primarily focuses on residents who require rehab after usually an acute hospitalization. They've had a major surgery, they need some further physical therapy, and that program is open to all veterans.
I think what makes Community Living Center unique is the wide range of services that we provide here. We provide a medical attending physician on staff. We have nurse practitioners on staff, quite a few social workers, psychologists, clinical nurse specialists, all on staff, which I don't think you'll find at many community nursing homes.
It's beautiful outside.
So for all of our residents that come in, we establish with them what is their goal of care. And their goals of care includes end-of-life care or advanced care planning. We have open discussions about end-of-life care and support our veterans regardless of what their decision is regarding end-of-life, but we actively engage the veterans in those conversations. What branch of the service were you in?
Army,
Army. And what
Nurse.
did you, a nurse?
U.S. Army.
Very good, very good.
There is something I think about the community of veterans. The veterans absolutely enjoy being with one another and sort of sharing stories and sharing that shared experience that they all have as veterans.
In many cases, this is not a final home for them. We do encourage the residents to continue to progress with the goal of discharge, even for our long-stay residents. If there is a place that is closer to home, that is more home for them, that is where we would like to see our veterans be.
Lemon.
It's lemon. It's nice color. Very green, huh?
Yeah. Very nice life here. I like the environment, plenty of entertainments. I play bingo. I go outside there and walk, take a walk. I am happy here.